Folks, thanks for coming on with us today. My name is John Dubas with Premier Marketing, and we'll be spending the next 45 minutes to an hour or so discussing the sale of Medicare Advantage plans, but done so in a compliant yet profitable manner. Today's presentation is being recorded, and it, along with much of the material that we'll reference, will come as part of the follow-up to all who have RSVP'd to today's webinar. A bit of housekeeping, if you would, in the questions box, if you run across something that we're not explaining through the course of the presentation, or you want to make certain that we get it answered by the end of the presentation, please utilize that section of the software so we can make certain that if it's something that we need to research, we'll make certain that we do so and get it to you, or address the question as soon as possible through the course of the presentation. Sometimes the questions are answered as part of the presentation later on, so bear with us if that is the case. A little bit of background information to start about our organization. We are a national marketing organization founded in 1968. That's part of the Integrity Marketing Platform with offices across the country. We act as an insurance wholesaler providing insurance products to the public through independent insurance agents such as yourself, and we do so through contracts that are available at the highest possible commission levels, with recruiting contracts available to those who qualify. As I mentioned, we were founded in 1968, so we recently achieved a milestone in our history, and that's our And folks, I hope you can hear me again. Yeah, it appears it's working. We lost all systems there for a moment. Internet, as you can see by the blank screen, and of course, the phone as well. I appreciate you hanging in there with me. We'll proceed with the presentation, and I apologize for the delay. As I mentioned, the portfolio of products that we have available that are really pertinent for today's conversation is the Medicare Advantage programs that are available through our organization. You'll note all the national carriers and many of the strong regional carriers that can make a difference for you in your chosen market. And that same philosophy carries over to the prescription drug program, where the national big boys are there for you for access through our organization. That same philosophy carries over as well to our Medicare supplement portfolio, which is very robust and has the programs that are in demand at this particular point in time, including a couple of really hot new entries into the area with the Aetna Ascendo program and the Humana programs that are out there for you as well, the Humana Achieve program in particular. When you look at the ancillary products, you have the leaders in each of those categories that are there for you. And let's discuss the Medicare market to some extent before we proceed into the presentation. The demographics that we have when you talk about a baby boomer generation aging into Medicare, well, everyone who comes on a program like this hears the story of a person every 10 seconds, 10,000 people a month coming into the program. But if you look at the Medicare population based just on age, you're not getting a true representation of the number of folks in Medicare, because there are some folks that turn 65 and don't immediately access their Medicare benefits. So it's skewed somewhere around 15% across the board. And you are also not getting an opportunity to look at the folks who have Medicare coverage because of a disability and they are younger than the age of 65. And that's almost 1/6 of the population that is on Medicare. So you have here in particular a target market that is very ripe, shall we put it that way, for Medicare Advantage programs, simply because many of the Medicare supplement programs that are available, well, it's mostly a Plan A in most states, and it's not a lot of help for these individuals. So we're looking at a market in need of help, a very diverse market where the Medicare population, the individuals have an average, well, 2/3 of them, 3+ chronic conditions. And they also have some challenges with their wallet and savings as well. So we're looking at a opportunity for multiple products and multiple programs that need to be part of your portfolio to fully address them, because it's a challenge that comes and develops even further when you get into multiple chronic conditions and a population that is in dire need of our help. So as long as we know a bit about these folks, we can basically make certain that we are accommodating their needs with the different programs that are available. Because when a person gains Medicare access, they have decisions to make. An old sales manager of mine in the Prudential days, longer ago than I care to admit, used to say, a decision to make a decision is a decision. And that's quite true. And if it's not made in a particular time period, it can have lasting financial consequences moving forward for the rest of their time on this green earth. So one of the first things they need to do is decide, am I going to pick up Part B? And if so, am I going to look to fill the holes in basic Medicare coverage with additional programs? And that may be as simple as picking up a Part D program for the prescriptions and self-insuring for the balance, or they may pick up a standardized, modernized Medicare supplement program, a Medigap plan to cover those differences, or access the topic for today, the Medicare Advantage programs, also known as Medicare Part C. If they do so, they're taking pretty much a even split for those folks that are coming into Medicare. You'll notice that the base of this information lent to us by Deft Research speaks about the age-ins and then the folks that are late to picking up Medicare as well. So you see nearly an even split with Medicare Advantage and MedSup, and you also have a portion that is staying on original Medicare only. That doesn't necessarily mean that they don't have any additional coverage. It means that they have other coverages available to them, or they've made the decision to make a decision and not pick up anything else. So what do we need to do? Well, we need to act in the mindset of one of my favorite movies, The Good, the Bad, Ugly, or however these went. So we need to make certain that as we do our discovery process during the appointment that we have, we do what's best for our customer and not necessarily what is best in our mindset, because we're looking to make certain that we don't fall into some of the sales tracks that some of us get into where, hey, I'm a MedSup guy. I'm not going to work with Medicare Advantage programs. I don't think they're a good deal. Or the Medicare Advantage folks, the devotees of those programs who say, why would you ever pay for coverage when you can get something free? Let's go through and look at it and make certain that first off, we're speaking the appropriate language. You'll note that in any type of industry, it seems like we have our own acronyms, obviously, and we have our own language. We have a decoder for you in that area where, upon your request, because this is a large file, we can make certain that we send that to you as part of the follow-up as well to decode the acronyms that we have in our business. Speaking of the Medicare Advantage plans, however, these are a type of Medicare health plan offered by a private company that contracts to Medicare to provide the A and B benefits. And in many circumstances, it also includes the prescription drug coverage. What I used to say back in the day of what is a Medicare Advantage plan, are you giving up Medicare to get into one? Well, obviously not, because if you did, you wouldn't have the qualifying factors in order to make certain you could enroll in the program, but you're basically assigning your Medicare benefits to a private organization, and they're accessing the program's funding from Medicare and are responsible for your entire claim in that circumstance. So unlike a Medicare supplement program that basically pays off of what Medicare is paying for the base and picking up the difference depending upon the type of plan, In this circumstance, a Medicare Advantage program is responsible for the entire claim. There are many different types of Medicare Advantage platforms, and by platforms I mean how are they accessing different providers within the community? Well, that depends on the program that's being offered and how that network is being accessed. And there's different ways that they can do it. We see a preponderance of Medicare Advantage programs in the first two categories, under an HMO basis where the network is closed for the most part, or a PPO or POS plan where they can go outside of the network, access care, and are responsible for a higher out-of-pocket. The private fee-for-service programs, well, there aren't nearly as many of those as they used to be, but boy, when they rolled out these programs, particularly in the broker channel, they were hotcakes to sell. And they were actually a program where you had to pick up a standalone PDP program to offer the drug coverage because it's not network-based, and that coverage could be sold as a side item. Some of the things that we see also as a type of Medicare Advantage program are the special needs programs, 3 different categories created by an act of Congress in 2003, the Medicare Modernization Act, that include chronic SNPs, institutional SNPs, and dual SNPs. We're not going to spend time with them today because they're, believe it or not, each of them is an hour-long plus, if you wanted to go into great detail, presentation by itself. And we rarely speak to the institutional SNP programs because generally they're not available to the broker community. You also see some less common type of programs, such as the MSA programs, the Medicare Savings Account, which years ago as a pilot program never really gained any ground. You saw it basically disappear and reappear here in the last couple of years. To qualify for a Medicare Advantage program, you got to live in the area in which it's approved to operate. If you move out of that service area and you notify Medicare of the change of address, they'll disenroll you. If you stay out of the area for longer than 6 months with many programs and Medicare knows it, well, guess what? You're back on original Medicare. You have to have Medicare Part A and B to qualify. And the one health question that comes into play is if you have end-stage renal disease. So it's not medically underwritten, and there's actually a proposal to CMS where end-stage renal disease will be eliminated in 2021 if that passes through. So what you've got, you have to live in an area where it's approved to operate. You got to have Medicare Part A and B. What that means, you can't be too young or too old, because you can be under the age of 65 and have Medicare until you pass. In my personal experience, the youngest person I enrolled was 3 years old, the oldest 102, and she lived by herself in a house in South Dallas. It was an interesting conversation because she was legally blind too. There used to be a second health care question, which was if you were in hospice. That has been absorbed into the Medicare Advantage programs, but for the most part, even though it's in the Medicare Advantage plan, it's still funded separately by CMS and Medicare. So you've got some different conditions you have to satisfy, and you have certain periods in which you can enroll into a period. The annual election period, the disenrollment or the non-renewal SEP program, the Medicare open enrollment period, which we're in through the remainder of this month with a possibility of perhaps being extended because of COVID-19, or perhaps a SEP program rolled into that instead of extending the OEP. What you have here is a listing of the standard SEPs we see year after year. We have a couple of additional ones that come into play. There's a special exception period for weather circumstances, and we may well see that SEP for folks because of the coronavirus. So how do these programs work? Well, basically a Part C program or an MA plan are an all-in-one alternative to original Medicare. You still have Medicare as a member of these programs because you have to have the A and B. And in many cases, as I mentioned earlier, the prescription coverage is rolled into the program. In many circumstances, You see the Medicare Advantage plans offer additional coverage like vision, hearing, and dental benefits. You see some transportation. You see some over-the-counter benefits. And because of some of the changes brought about by CMS in the last couple of years, you see some more non-traditional type of benefits being offered. There's actually a chronic special needs plan here in Texas, in Central Texas, that actually offers air conditioning as a benefit. Most of the time when you see some of the more non-traditional, non-health benefits, those are generally tied to a SNP program, even though there are some exceptions to that over the board there. What we have is also an increase in the number of programs that are available to the Medicare population. So you see an increase of the number of plans, and in many circumstances, depending upon the area, you may have in a particular county 8 plans offered by the same carrier. It's a fact in California. You don't generally see that across the board, however, and these are an opportunity for us to make certain that we look at the programs not only based on benefits, but since they are by and large network-based, how are those networks affecting our clients and prospects? Some different things we have to take into account. What happens is, in order to fund these programs, is Medicare pays a fixed amount for the care of the individual. This is noted as U because it's taken to a great extent right off of Medicare.gov. But the payment that a Medicare Advantage program is presented with is based on a number of different factors. It's based on if the person's a boy or girl, the county they live in many cases even to the zip code, health circumstances come into play as well, and their age. And what they do is they come up with an average of the cost of care for that individual, and they pay the Medicare Advantage carrier a discount of that amount. If a Medicare Advantage company makes over a certain amount, they have to either pay it back to CMS or enrich the benefits. We see in certain circumstances in different parts of the country, some of the D-SNP programs are basically frozen for enrollment for a year or two based on that very factor. And some of the other things that come into play with a Medicare Advantage plan, since it is network-based, many of them require a referral to see a specialist through the gatekeeper, through the primary care. And the other types of programs or the other types of benefits that are part and parcel of taking care of the Medicare beneficiary also have to be part of the network. So it goes beyond the primary care physician and the specialist. It deals with the hospitals. It deals with the DME carriers, the home health carriers, anybody that files a claim against Medicare for these programs. And for some folks, this can be a bugaboo when it comes to an enrollment, because in many circumstances, as an agent, you may have spoken with them a few times in order to get the appointment. Sometimes you might have had to go back for a second appointment to enroll the individual. But if they had a home health carrier in there and that wasn't part of the network, and they didn't realize that they were being reimbursed by Medicaid and not Medicare, a different scenario, you have a disenrollment. So some of the things you need to do as part and parcel of your appointment is to go through everyone who is part of the care of that individual and make certain that they are on a network that comes into play. Many of the programs offer prescription drug coverage. The Part D rolled right into the Medicare Advantage program, and you'll see that some of the programs that we discuss later this week, the low-income subsidy, extra help program, the Medicare savings programs, they affect the coverage costs of the MAPD plans in addition to a standalone Part D program. So we have to make certain that we are cognitive of income and assets for a Medicare Advantage individual as well. And it's very important not to assume those type of parameters based on where you're meeting. I have met with people in some of the richest parts of Dallas that were on Medicaid, but they were a parent living with a child, or in one circumstance, live-in help in an apartment over the garage. The main house was a multi-million-dollar house. She had an apartment over it. So some things that come into play, you can't assume things based on your surroundings. There may be circumstances you go into neighborhoods where, wow, it's a little sketchy to say the least, but those folks have, perhaps they don't qualify or disqualified because of their income, but they have assets that take them out of the additional help. So some things that need to come into play. One of the things that is important to note too is if you are offering a network-based program and you offer perhaps an MA only program, not an MAPD program, so Medicare Advantage only, not Medicare Advantage prescription drug, that person enrolling in a Medicare Advantage program is opting out of Part D. So we need to be very aware of circumstances like that. Those MA programs only can be a great help to certain folks that have prescription drug coverage, perhaps from a retirement plan, from a company they used to work with, or veterans in many circumstances. And it can be very helpful by a course of discussion with your prospect to find out exactly how you can best improve their situation. If a person has an MAPD program and they enroll in a prescription drug plan, it'll knock them off the MA program as well. So some of the things that come into play in the enrollment process you have to be aware of. You also have to be aware of on the back end for disenrollment too. When you speak of a person who's kind of on the cusp of why are you going into an AMA versus a Med-Sup, can you have them both? Well, if a person is on a Med-Sup program and they enroll in the Medicare Advantage program, they can't claim on the Med-Sup because the base claim is through the Medicare Advantage carrier and not CMS. So in many circumstances, you have to make the people very aware, well, in all circumstances, very aware of their choices. And the fact that they are enrolling in an MA plan doesn't cancel their Medigap policy. That's something they have to do on their own. And in many circumstances, depending upon the individual, their first year in an MA plan can be a trial where they can go back to the Med-Sup, mostly with the same carrier. There's one carrier that'll pick them for longer than that year, 2 years, but you have to be aware of the fact that you can't sell it and that, well, get on it and try it. If you don't like it, you can bump off. You want to use that pitch, you're probably going to get in some trouble with the compliance department of that Medicare Advantage plan that you're working with. So be aware of those circumstances as well. This goes into some of the trial periods going back to Medigap policy, and when a person disenrolls from the MAPD plan for one reason or another within a true enrollment period, they do have an opportunity to pick up that prescription drug coverage as well. It's important that we do so, that if that's the circumstance, we help them with that the Part D program, because if they don't enroll in a timely fashion, there's a penalty that goes with that as well. So the Medigap policy claims off of the filings against CMS. It doesn't work with an MAPD program. And you cannot refer to a Medicare Advantage plan as a Medigap plan. That's a good way to find out just how hot the water can be for you if you do so. Some of the key differences between MA versus Medigap, this is taken from Medicare Made Clear, and it lays out the networks and the referrals that come as part of it and when you can and cannot enroll. Obviously, we went through the different enrollment periods in the SEP programs. You can enroll in a Medicare supplement program at any time if you can pass the underwriting. Different states have different requirements, but it's something that you need to be aware of. If a person selects a Medicare supplement plan, you got to pick up that standalone Part D program, which, by the way, as I'm sure most of you are aware, It's only offered by private insurance companies, much as the Medicare Advantage plans are. This is another way of looking at those coverages based off of a piece from Aetna in this particular circumstance. And some of the statistics that you see, this is from an AHIP slide given to us, well, it's a couple years old now. Data always seems to run a year or two behind, but you'll see that Medicare Advantage plans are very frequently accessed by minorities. They're also accessed to a greater percent by females, which, by the way, well, that's hard to figure out. They outlive males, so there's going to be more of them to enroll in the program. And you'll also find that Medicare Advantage plans had a higher percentage of beneficiaries that are older. And in some circumstances, this was driven by the fact it could no longer afford a Medicare supplement and a PDP program and went into either a reduced premium MA plan or one of those without additional premium required. You'll see, too, that a lot of times the choices between an MA plan and a Medicare supplement plan is dictated by income. And this is one of the things that I think certain agents don't always take into account. We have a lot of Medicare supplement agents that have a challenge with the Medicare Advantage plans. Why would you do that to a person? Well, when you look at the median income of a Medicare beneficiary, right about $26,200, and you get below that amount, those folks have some challenges paying for a Medicare supplement and a PDP program. So it pushes them into a situation of, well, original Medicare doesn't have a stop loss. I've got some other benefits I need to access. This works out well for me. So you have a situation where these folks, depending upon demographics, you'll see where they fall, and that helps us in many times as to how we market to the population. And sometimes, even though these programs have been around for a long time, when I first started selling them in the mid-90s, there's an indication of age, they were called Medicare Plus Choice Plans. And you saw, even for a number of years, a big part of the sales process was education. And that's a lot of what we still do today. But I think you find more people aware of the existence, which we used to have to really sell against, and the advantages and disadvantages, remember the good, the bad, and the ugly of a Medicare Advantage program. Folks now are much more cognitive of the existence. And what you see then is kind of a reiteration on this slide as to how these folks fall and what some of your best prospects would be in those circumstances. And this can make a big difference if you're utilizing certain types of marketing programs keyed on income factors, age, and gender. So keep that in mind, where many circumstances, if you do a mailing for a Medicare supplement program, you don't always reach out to the older end of the spectrum. With this program, the age difference is a little easier for you to explain and to utilize, because what we're seeing is a swing back where folks have many more choices into the Medicare Advantages programs that they can access, and it's still dominated by certain carriers. So what you're seeing is Humana and United Healthcare, CVS being Aetna, the Blue Cross Blue Shield programs, and then some of the other carriers that aren't at present as large of a carrier, or pardon me, as large of a carrier with population in the Medicare Advantage programs. Any of these programs are either limited geographically or they have had a greater emphasis on the under 65 market. What you see with these programs, and one of the reasons why folks will contract with the two biggest ones, is because they have a national presence. They're in every state. And once again, when you have a higher number of folks to draw against, a larger population, obviously you'll see a higher enrollment. And we're seeing that enrollment nearly doubling over the last decade. And predictions of ongoing support of the Medicare Advantage programs, regardless who is elected in the near future. You see this hanging strong throughout the foreseeable future. Look at those numbers. It's kind of stunning to see how they keep on increasing and becoming even larger part of the Medicare programs. But what you have then are many of the programs that are available to help with people understanding their choices. These are pieces, this particular piece is a video from Medicare and You, from CMS, that helps explain the process to individuals. It is linked into this presentation as well. So you'll see that from the government, and you'll also see it made available through the infamous, after last fall, I'll put it that way, Medicare.gov Plan Finder. This, however, is a great way for you to look at the entire benefit package or the entire offering to the population in a particular zip code, because it'll lay out every plan that is available to the population, including ones that you may not contract with, or including ones that may not contract with the broker population, because they don't all do that. So it's important for us to not only do what's best for our prospects and clients, but also keep in mind that we are not social workers and we need to do what is right for all involved. Your services, as many of you deliver in a very wonderful manner, is also a piece that is important to realize that you are due compensation for your services. On our website, we have the benefits for each of the carriers with whom we contract. If you remember a few slides ago, that's a pretty substantial number of organizations. We don't contract with them all either. So something to consider. Whoops. Here we are too. One of the reasons a lot of folks will pursue this particular market is because it has a high persistency. The folks generally will, when they enroll in a program, they don't generally switch. Back in the days when I worked for United Healthcare SNP programs for the Central Region, we used to call that one of the pieces that we had was saying that, pardon me, the biggest challenges we had was the celestial discharge. People stayed on the program until they passed away. You see a little more movement than that now, but generally when someone becomes enrolled in a program, they don't switch. And for many of us, that's a challenge, particularly if they're on a PDP program, because the formulary changes, the drug may change tiers within the program, the prescription use may change. So there's a number of things that need to come into play when we look at how a person is best served by the programs that are available to them. You'll see also that many of the carriers will lay out different carrier sales presentations. And there is, pardon me, one of the things I wanted to show you here. Much of us, what we're seeing now with some of the changes brought about by social distancing, some of the legal requirements of getting out and about and visiting with folks face to face, if that's in the best interest or not. There are different organizations making telephonic presentations available to you. This particular piece from Humana will come as part of the follow-up as well, and I think can be very helpful to you down the road. They also have a number of different videos that are very helpful for us to become accustomed to the presentation. And one of the things I used to do is make certain that if I did a seminar or if I did an individual presentation, I kept to basically the same sales track, because then I could always say I covered that. Because one of the challenges you may have with some of these individuals is, hey, that's not what they said. Well, you can document and do what you need to do and make certain that it works. You also have different presentations made available by the different carriers as well as to what Medicare Advantage is. This is a piece from Aetna. And then you have the Medicare Made Clear series from United Healthcare that is very helpful as well. Some of the things that we're also looking into and making certain that folks are aware of when we are socially distanced is how some of the telehealth is handled. What you'll see in many of the Medicare Advantage programs is that's a benefit that is baked into the program. So in this time period, it helps us when we look at how our folks are going to be able to access the care and making certain that they can do what's necessary, even if they can't get out of the house in a particular circumstance. This is a piece that would apply more to Medicare supplements because those are covered as part of the base Medicare coverage as well. One of the things that we want to make certain that you are aware of as well is the different tools that became very popular with some of the challenges with the Medicare.gov plan finder. And the tools that are out there that are offered by our organization deal with Medicare Center. And this gives you basically not only a program that helps you collect the scope of appointment electronically and store it for the 10-year period, whether you sell them or not. Keep that in mind. You got to collect that scope. If you sell them, you keep it in play and in storage. If you don't, you have to as well. But it also gives you the opportunity to save their information year over year and utilize the system as a mini CRM to work with those individuals year over year and throughout the year as well. What you have in many circumstances is an opportunity to sell somebody as long as you keep that permission to contact in play the next year, even if you didn't sell them the first year. So some of the things that come into play are very helpful for you in that circumstance because, you don't have to re-enter all the information. And when you go back to that individual and speak to them about their coverage because of a SEP or because of, well, it's now open enrollment again, you have the base information and it speeds up that process a great deal. This is also a tool that will be sent to you that basically walks you through a quick quote as part of that program and will come to you as part of the follow-up to today's presentation as well. So a nice way of basically taking care of your folks remotely. This is particularly helpful for the individuals who want that personal touch. Go out and visit with folks when you're able to, and make certain that if they're the type that says, I want to think about it, you got to determine why they need to think about it, obviously up front. But there are some folks that just won't buy on the first presentation. This gives you the opportunity to collect that application remotely, time efficiently, and still compliantly by using the electronic tools within the system. So this is part of what you'll have as part of the presentation, a way of walking through different portions of that program as part of the plan. All this said and done, it's all well and good, but what do I get paid for this? These are agent level compensations. They are set by CMS. When the standardization of compensation came out, they came to us as carriers. I still worked for United at the time, and they asked us, well, they weren't asking me, they were asking someone obviously up a little higher on the chain, what you would propose as payment for an individual. And what you saw at that particular time was many of the carriers offered a much higher first-year commission and a much lower renewal commission. In the long run, I personally am happy it turned out this way because those renewals are your salary year over year. And you'll see that the compensation has basically different categories as to where you're compensated. The national average for all but 5 of the states are right up top, with the renewals being half of it. And you'll see that year over year it increased between 5 and 6% all across the board, even with the PDP programs as well. You'll see in many circumstances this can be a big difference, the renewal rate, because these are the maximums. This doesn't mean this is what the carrier has to pay you. However, in order to be competitive, you'll see that first-year compensation be pretty standard across the board. If you're in California and New Jersey, you got a higher chunk up front, and the renewals are higher, but you also have competitive atmosphere there that you have to deal with. So in the long run with these programs, you can build up a very nice renewal base by selling MA consistently and doing it throughout the year. But it's important to remember that one size doesn't fit all, and so we need to look at how we can cover other things that Medicare doesn't, and that includes the prescription drugs if they're not in an MAPD program, some coverages outside the United States, travel insurance, the short and long-term care aspect of this, which I got to tell you is crippling for many folks because they thought, boy, Medicare is going to take care of that too. Nope. And you'll see the shortcomings in the ancillary programs as well. So how do we get in front of those people? There are different things that we can do in a combined basis in order to reach the folks we need to reach to speak to those decision makers. There are certain programs that you can cold call. You can cold call for med sups. You can't cold call for MA or PDP programs. You can also cold call for some of those extra benefits that Medicare doesn't cover. So dental programs, cancer plans, heart attack, stroke programs. Many folks will work final expense programs with the population, have them as your create a client, and you can work your business then year-round based off of that relationship. There are also different community-based programs that are very helpful for you. And keep in mind, this is in a regular type of situation where we're not locked down with social distancing and the different challenges we have at present. But retail programs are available through many of the carriers themselves, and then, of course, through the Walmart campaign. Walmart campaign's basically gone through, instead of a cutoff at the end of the year, there are Walmarts up and operational through OEP. And there are considerations at present on maintaining some sort of presence in the store year-round. I would guarantee you that if I had a Walmart and I worked through AEP, and then I also kept my foot in the door through OEP, I would make that a regular part of my contact circle, be it face-to-face or telephonically, where they had my information, because you're taking advantage of the SEPs that are available for those folks and work year-round. We have a presentation tomorrow that deals with a center of influence in the community, and those being faith-based organizations. And we'll walk through how you can have that as a strong part of your overall marketing program. There are people within our community that will respond to information that has basically been vetted to a degree by their faith-based family that they won't respond to through any other type of marketing efforts. And then, of course, working with providers as well. We have different series of trainings on that, and you will have links to past presentations in all of these categories. And then obviously we invite you to tomorrow's faith-based presentation, and then we have an LIS MSP presentation on Thursday. There are also different carrier programs that can be very helpful to you. You see during AEP a relationship built with certain MA programs where they may push you leads as well. Sometimes I used to refer to those as Lazarus leads, because you got them after they were dead and you were looking to resurrect them. You know, and sometimes though, you'll see a captive make 1 or 2, maybe 3 attempts to get a hold of somebody and then dump it. Well, they're still hot. It's just a question of when can you reach those people. And many times, varying the times that you're dialing because you have permission to reach out to them, well, that can make all the difference. There are different community activities that you can participate in that can be very helpful, different health fairs, working with park and recs departments, different programs like that that can be very helpful. Door knocking, we've seen some information come into play with some folks that are doing it now. I wouldn't necessarily recommend that. They're door knocking for Med Sup, which is compliant, you can't do it for MA or PDP programs. You see a lot of emphasis on social media programs at present, particularly Facebook leads. We have a program like that as well. Very effective in the final expense arena. Some details will be coming out from us on that for the Medicare space. And we do still support direct mail. We're seeing a lot of extra orders going in right now, and you have a higher response rate on that regardless of the product that you are mailing for. DSNP letters are very effective at this particular point in time, and they're one of the few categories that I am not as adverse to being labeled by a particular company. If you do that, in many circumstances, they'll help you pay for it. They have different support programs for that if they are logoed appropriately. Generally, when you reach out for Medicare Advantage programs or Med Sups, you'll see a generic letter get a little higher pull. There are some rather innovative ways, however, that different Med Sup companies help overcome that. So some of the things we want to make certain that you realize is you have access through some of the different tools we make available to our contracted agents without cost, including the CSG tool, which lays out a number of different categories for you that, gee, those 5 cups of coffee this morning is blurring my vision. No, I probably blew that up too large there. But this is a tool that enables you to collect the scope of appointment electronically, store it compliantly, and then get quotes on Medicare supplements, which help you with a review of their current coverage and also gives you an indication of the carriers that are most competitive price-wise in your area. Once again, you have to look at some of the other things that come into play. It's also a great way to get information on Medicare Advantage and PDP programs, and we have a piece on walking into a house where a person is basically looking for reinforcement of the choice that they have. They're going to stick with the program no matter what you do, because in certain markets, some Medicare Advantage carriers have a hold on the market. If that's the case, there's a program within this that helps you fill the holes. You can select that program and add on a hospital indemnity program to cover one of the major discrepancies in that coverage. It also helps you sell dental programs, walks into a conversation with final expense. Keep in mind, if you're doing a Medicare Advantage or PDP program, you can't sell that final expense that same appointment. You get that 48-hour cooling off period for a non-health program. It walks you through also an opportunity to sell electronically with applications generated through that system as well. It also gives you detail on how to do that. So one of the things that will come to you is the EAP process for that program and how to obtain that scope. There are also that cross-selling piece that I mentioned to you that allows you to make certain that you are better protecting your prospect and client and generating income for yourself by filling the holes. That will come to you as well. So those electronic tools are available to you without cost. There are a number of webinars being generated within our organization for Medicare Center as well, and it will give you detail on walking through those. If you are on our e-blast list, obviously you're going to get invited to those as well. Some of the things that we're going to do to help you by contracting with us at Premier is give you an opportunity to make it as simple as possible of reaching out to different carriers for contracting without endangering yourself with carpal tunnel. This software program allows you to create an agent profile, store your E&O coverage, your licensure information. It also allows you to answer the questions once that you'll find on the contracts, and it'll autofill those for you electronically through this system. Not all carriers will take advantage of this contracting system, so there are a few that you still have to contract with manually as well. We do offer discounted E&O to our qualified agents. That means you're contracted with us for at least one thing, and it gives you the opportunity then to have that coverage for all your products, regardless of the multiple hierarchies you may access your contracting through. This is a great help as opposed to, okay, I've got one contract with this company, they're going to add me to their blanket E&O, but I'm left hanging in the wind for everything else. Not with this. You're going to pay for a little bit for the coverage, but it's going to cover you across the board. We also help in making certain that your continuing education maintains your licensing. And if you are not licensed at present, or if you are working with agents that need to pick up their licensing, this can help them do it at a reasonable price. As an independent agent, you also maintain your own benefit structure. This gives you the opportunity to pick up DI coverage on a modified guarantee issue basis at a discounted rate where you're sharing in the commission. So it helps add to your own process as well. We have a ton of different training programs that have been recorded and are ongoing, making certain that we stay up to date with some of the different pieces that are there. And these are found either on our website at premiersmi.com or on our YouTube channel, or I have a singular document that has them all as well that we can get to you. This is an area that has seen a little bit of challenge over the last few weeks because of the COVID-19 virus, but we have a place on our website too that makes certain that you're aware of all of the income and reimbursement, so to speak, that is available to you through the different carriers. And in many circumstances, that helps you qualify for our convention as well. You will not see carrier trips or incentives being funded by Medicare Advantage or PDP programs. That would be a violation of that standardization of compensation. So the different programs would help you then qualify for all these trips. This year's trip was supposed to be a cruise from Miami to the Bahamas. It has been canceled because of the challenges we're seeing around the world. Next year's trip will be announced shortly. Some of the things that we can do to help you get in front of individuals as well, if you are willing to engage in a relationship with Ma Bell, we can help you with a custom contact list that's bumped up against the do not call list, available to you at either a deeply discounted rate or at no cost at all to you based on your contracting status. We'll help you with the different programs and approaches through the community-based programs where you can reach into those centers of influence and become the subject matter expert in your chosen market, help you access those carrier-generated prospects because of the size and production our organization does in association with agents such as yourself, get you the internet leads program and that direct mail support. That contact list is variable, so you can pick the parameters on it as to the age, income level, and obviously the area in which you choose to work it. And it comes to you with a caveat because not all programs allow for cold calling. You can't cold call for Medicare Advantage or PDP programs. Those retail programs, which in many circumstances are seasonal, doesn't necessarily be predicated by the different carriers or even the Walmart campaign, because we have a way of setting you up on a do-it-yourself basis as well. Those faith-based organizational opportunities, that's a piece that we're going to dive into in great detail tomorrow, but it also gives you the opportunity to reach out to these folks now, because many times they don't know where to turn to for information about the challenge we're all facing at present, and we can help you with those different types of discussions. We'll go into that in greater detail. If you are an individual who's comfortable with seminar selling, we have a variety of different types of programs that are available to you in PowerPoint that give you a sales track to walk on, and a system to help you market to providers as well. It's important to note that these providers don't necessarily have to be part of a network, because there may be doctors out there that don't want that, and they still need help with getting their people coverage. And that may be a med sup, and PDP program reviews that can help you down the line. Those carrier information pieces, a lot of that is a symbiotic relationship. If you're working with a particular carrier and you attend their trainings, you speak to your agent manager with that company on a fairly regular basis, they'll think of you when opportunities come about. And these lead programs that you generate may not just be something that, okay, this person's responded to some type of media outreach. It may be, in the regular times, a community activity where they're looking for help, where you get the leads out of that. As I mentioned, we do help with the direct mail support. It's deeply discounted based on production. So you'll see an opportunity to do a regular mailing, which is important, much like an exercise program. If you only do it once in a while, you'll feel a bit of the pain and not see as much of the results. So if you do some things consistently, it's going to help you with those apps. It's going to get you that support, and you'll be able to consistently drive into a market. Then, of course, the internet lead programs that we've mentioned as well. This is all an opportunity for us to work together to achieve a shared goal, and that is growing a book of business for your agency with multiple income streams. If you are a Medicare supplement agent, finger quotes working, being exposed to the Medicare Advantage world, well, you'll see some folks, I don't want to do that because I got to certify each and every year. For me, that's an opportunity to make certain that I stay up with the challenges left by people who aren't doing that. You're going to be able to advance over the folks that don't want to put in that time, that effort, that sweat equity that's required. There's also then a determination if this is going to be part of your personal marketing plan. I always bring up John Wayne's Cowboys movie. Do it now. We're burning daylight. And for those that are reluctant to pick up some of the certification in March because the new one comes out in July, well, I don't know about you, but I still got bills to pay in those intervening 3 months as well. Plus, if you do the AHIP the first time, the renewal certification is not nearly as challenged in the near future. You can reach any of us here at Premier through our toll-free number at 1-800-365-8208 or through our website, or respond to the email presentation or the email information that's going to come to you as soon as the recording updates. With the challenges we had initially, there's going to have to be a little chopping to make this a listenable event. I don't think you want that dead time on a recording as well. So watch for that, and we'll make certain that we answer any additional questions that you have. As I go through the questions that came out, yeah, the vast majority of these have to do with the challenges we had with the sound and the progression of the slides. Once again, my apologies for that. We'll make certain that the recording adjusts to that, and watch for additional documentation that we'll send with the follow-up. One of the questions deals with, will Medicare supplements be added to Medicare Center soon? That is something that they are working on for greater access and a comparison piece of it. You're also seeing some other upgrades being made to that system that are still in negotiation, so I have to bite my cheeks and not divulge them because they're not completely part of the contract as well. So all that said and done, we look forward to visiting with you about the opportunities in the Medicare Advantage world. Some of the things we want to do is make certain that the detail we pull is based on your target market. So we're going to go in and work with you on the plan finder to make certain that you have, much like you can find in the CSG Med Sup quote engine, the plans that are most applicable to you. So in the meantime, until we visit again, we look forward to that conversation, but we wish you good selling. Keep in mind, there are many electronic ways to reach out to folks. You got a grand opportunity to take advantage of other folks backing off at this particular point in time. That said, thanks so much, and we'll talk to you soon.